I would
Great.
like to welcome all of you to this webinar, Learn the Signs, Act Early. My name is Rhonda Raridan Nelson, and I'm a community health consultant at the Iowa Department of Public Health. Our presenter today is Rochelle Swanson Holm. Rochelle is a Family Navigator Coordinator for the Regional Autism Assistance Program at the University of Iowa Hospitals and Clinics. She works with family navigators and other team members statewide to connect families to services and supports for children with autism spectrum disorder and other developmental disabilities. Rochelle has an extensive background in family-to-family support and family leadership roles that include working with numerous stakeholder groups across Iowa to improve the system of care for young children with autism and developmental delays, with a special emphasis on early detection and intervention. Rochelle is the CDC's Act Early Ambassador for Iowa and is especially committed to collaboration with parents, healthcare professionals, early care and education providers, primary care providers, and programs that serve young children. Objectives of today's webinar is to provide professionals with an overview of Iowa's Learn the Signs, Act Early campaign and the Regional Autism Assistance Program's goals to improve early identification of children with developmental delays and disabilities, including autism, so children and families can get the services and support they need as early as possible. So just a couple of housekeeping items before we begin. To reduce background noise, all participants have been placed in listen-only mode. At the end of the presentation, we'll try to have you unmute yourself. So if you have questions to ask, and if that doesn't work, you can always, or if you prefer, you can just type your question into the chat box as well. So just letting you know that today's webinar is being recorded, and it will be posted to our website, www.promotementalhealthiowa.org. So we are very excited to have Rochelle join us today, and I guess with that, I will turn it over to you, Rochelle.
Well, thank you.
Thank you.
Well, I want to thank everybody, and especially Kelly Puzzle and Rhonda for inviting me to speak today. And I also want to thank the Iowa Association for Infant and Early Childhood Mental Health. And I'm really excited that you all joined to learn a little bit about Iowa Act Early, and especially to hear about helping children learn and grow by spotting those amazing milestones, and also to learn about just the entire program, Iowa Act Early. Okay. Advance my slides. So Rhonda kind of went over some of the objectives, but I wanted you to also see them. And Rhonda's going to send out a copy of the slides today, so you'll all have those, but we're definitely going to be covering a lot of information today. Most of the objectives are pretty simple and clear, and by the end of this hour, I hope that you'll be able to do all 4 of these things, which include just describing the importance of early identification of developmental delay and disability, be able to summarize the Iowa Act Early campaign, describe the value of family voice in early identification, diagnosis, and intervention, and also have a really great understanding and be able to describe the Center for Disease Control and Prevention's Learn the Signs Act Early program materials and the online trainings that are available. I've been selected to serve as the Center for Disease Control and Prevention's Act Early Ambassador to Iowa. Iowa Act Early is a program that largely attempts to improve early identification of developmental delays and disabilities, including autism. And it's primarily by increasing parent-engaged developmental monitoring and screening practices across our state. This program through the CDC works with HRSA, which is the Health Resources Services Administration, AMCHIP, the Association for Maternal Child Health Programs, and the AUCD, the Association of University Centers on Disabilities, and others like the American Academy of Pediatrics. There are 3 main objectives of the Act Early program. And that includes the first objective, which is the health education campaign. And that health education campaign promotes awareness and primarily of three things: healthy developmental milestones in early childhood, the importance of tracking each child's development, and the importance of acting early if there's a concern. The second objective is the Act Early initiative, and that initiative is because the Act Early program works with state, territorial, and national partners to improve early childhood systems. And they do that by enhancing collaborative efforts to improve screenings and referral to early intervention services. And also, they support the work of Act Early ambassadors to promote the Learn the Signs Act Early messages, tools, and improve early identification efforts in their particular state. And the last objective all centers around research and evaluation. And that is primarily to improve the campaign materials and implementation initiatives so that it will help increase understanding of the factors that influence early identification and referral. And I can give you an example of that. African American children and Hispanic children are less likely than white children to be identified as having autism spectrum disorder. And so once we kind of know that, then we need to try to figure out, okay, so how can we change that? So as the CDC's Act Early ambassador to Iowa, I serve as the point of contact, support Act Early teams in our state and other states, and other initiatives as well. And mainly, I do a lot of promotion and awareness as a large part of my daily work. So this is a picture of the ambassadors at our Atlanta training and networking meeting last summer. We will be having a refresh meeting again this June. And on a fun note, we did get a little fun time in during our two-day training. And basically we were able to go through the CDC museum where we spent time on the 3 floors to learn all about initiatives that went back to 1946 to present day. But the ambassadors include medical, child development, special education, public health, and early intervention professionals and parent advocates from over 49 states and territories. We are all striving to share the Learn the Signs Act Early program and materials, which aims to change perceptions about the importance of identifying developmental concerns early and give parents and professionals the tools to help. The Act Early Network provides a forum, so we of course have email capacities to contact one another. We have a SharePoint. We attend a lot of webinars together, and of course we have newsletters as well. And all for these champions in various states and territories to share individual creativity and expertise towards meeting the needs and addressing challenges of each ambassador's own state or territory. So in summary, we network a lot and we copy each other's ideas and different things that each state's doing that we might think might be effective in our own state. I know Rhonda shared a little bit about me professionally, but I also like to always share a little bit about my personal life. So I'm the mother of 3, and this is a picture of my family, and we're all big Hawkeye fans. And a little bit about me is that I've always been pretty passionate about healthcare and family support since I was first out of college and had my first job as a therapeutic recreation specialist. I did work in the mental health arena for over 13 years, and I think that really laid a really great foundation for seeing a real need to work with families of patients as well as the patients themselves. I started working at child health specialty clinics about 9 years ago and have worked in a variety of positions And like Rhonda said, presently I work as a family navigator coordinator for the Regional Autism Assistance Program. And of special note, I think, is just to share with you that I have lived experience of being a parent of a child with a noticeable developmental delay. And of course, that has taken me on a long journey, as you can see, because my daughter is now 27 years old. So I do want to really spend some time with you talking about why this program is important for our state. So you probably know the early years of a child's life is very important for his or her health care and development. Healthy development means that children of all abilities, including those with special health care needs, are able to grow up where their social, emotional, and educational needs are met. The CDC Learn the Signs Act Early program aims to improve early identification of children with developmental delays and disabilities, including autism, so children and families can get the services and support they need as early as possible. We want children to have the best chance to get the help he or she needs to have the brightest future. Early recognition of developmental delays and disabilities such as autism is key for parents and providers. The CDC realized the impact on families and invested in this campaign to help parents measure their children's progress by monitoring how they play, learn, speak, act, and move. And the campaign, again, is called Learn the Signs, Act Early. I'm sure you most likely recognize that your association's mission of building community awareness of the importance of early childhood development and your vision of all children will experience nurturing relationships and social and emotional supports to reach their full potential is quite parallel to the Iowa Act Early and Regional Autism Assistance Program's mission and vision. I always like to include a little data, and so it's always important to recognize national numbers and Iowa numbers. And so I just wanted to share with you today that there are 150,000 children in the state of Iowa that have a chronic special health care need, and there are approximately 120,000 children ages 0 to 3 in the state of Iowa at any one time. Roughly 20,400 children will have special needs, autism included, and many children with a developmental disability are not identified until after entering school. We know early intervention before school age can really have a significant impact on a child's ability to learn new skills, as well as reduce the need for costly interventions over time. So I just want to remind you all that you can have a positive impact on helping Iowa's children if we push the needle together to improve early identification and early intervention. A little bit more about the issue includes some of these numbers. And this kind of shows how we're pretty much on target with some national averages. But in the 2010 census data estimated that there are 10,750 Iowa children and youth 0 to 18 years of age with autism spectrum disorder, and that kind of ties right in with 168 nationally. And 121,000 Iowa children and youth with developmental disabilities, which averages out to be that 1 in 6 children. It's important to realize that there are fewer than 50% of pediatricians using valid and reliable screening tools, and the median age of a diagnosis for autism is 4 years. And then again, we just kind of keep in the back of our minds that prompt identification can spur specific and appropriate therapeutic early intervention. And that's what we all want. So our Iowa Act Early campaign does have a couple of goals, and as stated earlier, from birth to 5, there are milestones children should reach in terms of how they play, learn, speak, act, and move. And a delay in any of these areas could be a sign of a developmental problem, even autism. So fortunately, the earlier the delay is recognized, the more you can do to help them reach their full potential. So the Iowa Act Early goals play a significant role to provide education and training in our state so we can improve our comprehensive state systems of services for children with developmental delay in AUSD and their families. But we know we can't do it alone. And so every state an ambassador represents works with state and national leaders to promote Learn the Signs, Act Early. So here in Iowa, we work with Child Health Specialty Clinics and the Regional Autism Assistance Program within the Division of Child and Community Health through the University of Iowa. The division is comprised of clinical services, technical assistance, and practice transformation services and various public health services. Child Health Specialty Clinics is Iowa's federally contracted maternal and child health Title V program for children and youth with special health care needs. So our designation of the Maternal and Child Health Title V program means that we're charged to develop and implement comprehensive coordinated systems of care for the children with special health care needs. And those efforts allow for a smooth integration of the Iowa Act Early goals mentioned on the previous slides and efforts that we could not do alone. So you can see here some of our agencies that help provide some financial resources to our program as well. So part of our mission and purpose is to collaborate and partner with other organizations to increase integration, decrease duplication, and create positive working relationships so that families can better be served and their needs can be met, and we can solve some problems perhaps and provide services that can be advanced through our collective impact. So we have collaborated in the state with a lot of different programs, such as the Integrated Health Home for children and adults with mental health diagnosis, developed workforce training strategies, such as peer support, with the Department of Human Services. We have also partnered with Iowa Medicaid Enterprise to serve children on waivers and develop and disseminate guidelines for measurement and best practice. So I need to tell you a little bit about the Regional Autism Assistance Program and its rich history. So it's been around for quite some time. Many of you probably know this. And legislation in 1990 created the program. It's been called different things throughout those years, but we call it the Regional Autism Assistance Program now. And it was legislatively dictated that Child Health Specialty Clinics help build this system, state system of services and supports. And again, you can see that the Iowa Act Early goals mesh really nicely with the RAP mission. Because we work so closely with Child Health Specialty Clinics, we were able to establish some regional autism assistance program teams in all of the regional centers throughout our state. And this kind of gives you an example and a visual of how we can try to help all 99 counties in our state. And each center is made up of teams of advanced registered nurse practitioners, registered nurses, and family navigators. Each team member, the ARNP, the nurse, and the family navigator acts within their area of expertise. Here, this kind of lists some of the things that they provide that kind of surround the arenas of care coordination and family-to-family support. The advanced registered nurse practitioners and some of the nurses have been trained to do secondary screenings before communicating with diagnostic facilities to do a full assessment for suspected autism spectrum disorder, and this helps wait times for diagnosis. The RAP referral process is really simple. Anyone can call a RAP team either at the center or at our administrative offices. And we want people to call even if their child has a suspected developmental delay or they're concerned about autism. They don't, of course, have to be diagnosed with autism in advance to get services from the actual assistance program. And once they are referred, then they will be helped by any number of these teams to make sure they are able to get the services and supports that they might need. The Regional Autism Assistance Program works with all those state partners, and through that participation and collaboration, they were able to develop a strategic plan. It's a 5-year plan, and this slide just kind of outlines the 5 main focuses of the overall arching plan to help families with ASD. So, of course, getting a good start, having access and obtaining needed services, having well-informed, empowered, and supported families and caregivers, successfully transitioning to adult life, and being assured of ongoing coordination of systems of care and support. And so you can see why the Learn the Signs Act Early program really ties in very nicely with the strategic plan. So the Iowa Act Early state team activities are quite similar and really are parallel with the Regional Autism Assistant programs. So we're working real hard to provide statewide education and training, and that includes the things listed here: awareness, monitoring, screening, referral, assessment, treatment, and family support. And of course, collaborating with a lot of statewide partners, and this just lists a very few, but we're really out there really trying to work hard at collaborating with all different types of parents, professionals, agencies, etc. And of course, research and evaluation activities are a big part statewide as well. And then kind of a little bit back to some of the Iowa Early activities and how they're woven into the mix, especially of the strategic plan. So the awareness activities, we want to increase public awareness. So, and we do this through a website, the materials that we can disseminate, a lot of the free CDC Act Early materials, and that type of thing. We work collaboratively with the American Academy of Pediatrics. We really want parents to be able to talk to their child's primary care provider and early education and care providers regularly about development. And in fact, studies show that 86% and 81% of parents respectively expect being able to talk about their child's development at every well-child visit and every one-on-one conference with care providers. And so we're really interested in helping this process. And so we know that the Academy encourages and recommends that all children be screened to assess their general development at 9, 18, 24, 30 months. and that all children are screened for ASD at 18 and 24 months. But we do know that in our state of Iowa, we do have a lack of developmental screening taking place. We do live in a rather rural state. We have few pediatricians and a health climate that sometimes encourages 15-minute visits. So we are trying to, through our Act Early program, really get the word out there and help providers with making sure they have the information and the screenings tools and resources available to them. This just kind of helps you get a visual about developmental monitoring versus developmental screening. And this is a big piece of Learn the Signs Act Early, because we're really promoting developmental monitoring, especially to be done by parents, teachers, and other healthcare professionals. The most important reason for monitoring each child's development is to find out if a child's development is on track. It's important to act early if there are signs of a potential delay, because early treatment is so important for improving a child's skills and abilities. And we know that screening of young children for healthy growth and development is recommended to help identify potential problems or areas needing further evaluation. And screenings are used only to monitor whether children are at risk for delays in their growth and development. And you can see where they overlap a little bit. They both look for developmental milestones, and they're both important for tracking signs of developmental and identifying concerns. And so I especially want to emphasize how these Learn the Signs Act Early materials and tools help both those that are monitoring and those that are screening. So what are the developmental milestones? And most of you probably already know that, but we do want to get the word out to a lot of different people and make sure that they do know what developmental milestones are. And one of the tools that the CDC has is a Milestones in Action free library of photos and videos of these particular milestones. So they are able to help parents and providers to really hone in and recognize what are healthy milestones. They are there to help you learn how to track milestones and help learn important strategies and activities to go along with each of those milestones so we can help children learn and grow. We do recognize that all children develop at their own pace. Some will reach milestones slightly late or early, but most children reach milestones around the same ages. So just for fun, I'm just going to run through a few photos of milestones, and want you just to be kind of thinking as we go through them, what these photos what milestone might they be depicting. And so it's just kind of on your own, just for fun. So, and these are like tools that are right on the website that a provider could actually use with parents as a coach and a mentor, so you could help your families really hone in on what these milestones really look like. So, what is this 4-month-old sharing? And we know that 4 months old should probably be holding their heads up. And so we'd want families to recognize that. Reaching for a toy at 6 months. At 9 months, this little guy is standing while holding his mom's hands, and so most babies are able to do that by the time they're 9 months old. Sharing milestones with parents like this can help them have realistic expectations and better understand their child's behaviors. If parents do not know when a child should be having a certain skill, they may worry unnecessarily. So tracking milestones is a great way to avoid that as well. Okay, so this 1-year-old is clapping just like her mom. And by the time most babies are 1, they are able to copy gestures. And another thing that we always kind of want to point out to everyone is that we know it's not much fun to share information about late milestones. But it's important to give parents that information as well. So as you kind of explore the CDC's website and you maybe pursue some of their trainings, and I'll talk about that a little bit later, the trainings help teach how to carry on those conversations with parents so that you can still enhance that relationship with the parent and make difficult conversations more successful. So, and this 18-month-old is, of course, feeding himself with a spoon. And we always try to remember that, tracking milestones and celebrating success of reaching a milestone, no matter what age it is, those types of things can be really infectious to parents. Parents love to work at having their child meet some of these milestones. Catching a ball at 4 and then kind of copying and wanting to please another friend by doing what they do is a common milestone in a 5-year-old. But again, these are all pictures and there's videos as well at the library site right on the CDC website. And I'll be giving you that link in the PowerPoint that Rhonda will share with you, so you'll be able to go right to that site and find all these. So they're great teaching tools. So other materials that the campaign has available, I'm going to share quite a few of those with you now. And I just want you to know that all these campaign materials are free. They're also research-based, audience-tested. They really kind of hone in on helping parents become better partners in monitoring development. They are useful for anybody who's working with a young child. They're written in plain language, and again, focusing, of course, on milestones, when to act early, and what to do if you are concerned. And of course, that's our big statewide message. So here's an example of a lot of the materials that are available. There are growth charts that list a lot of the milestones and tips and strategies as well about how to reach those milestones. So parents always enjoy actually getting something they can actually use with their child. So a growth chart's always fun, and to put pictures on it and that type of thing, and it's a nice keepsake. There's a lot of check-off sheets available and booklets. There's posters. There's tips and tools for just about every professional and parent. And they're all free. One of the nicest pieces of the collection, in my opinion, is the Milestone Moment booklet. And it's on the right lower hand piece of the screen here, but it's a booklet that covers 0 to 5 years of age. It has all the milestones that a child should reach at each of those ages throughout their development. And then it has lots of great tips and strategies to encourage parents and caregivers so that they can work towards meeting those milestones as well. There's printed materials that are available as well, and there are 2 children's books with milestones highlighted throughout each of their stories. Where is Bear is for 2-year-olds. Amazing Me, it's Great Being 3 is, of course, for 3-year-olds. There are parent sections, and there's also interactive e-versions of these books on the website that you can download. And there's coloring sheets, and these are a lot of fun, and they come in Spanish as well. And most of the materials the CDC puts out all come in Spanish. And then there's other languages available as well, but on a limited availability. And so you can look for them yourselves, or you can also contact me, and I would help try to find different materials available in the language that you'd like to find them in. So it's something you can get, but what I do usually is go to my fellow ambassadors in all the different states, because some of their projects center around getting materials printed in various languages based on their state's needs. There's materials available that you can print from your home or office copier, and those can include some monitoring and screening fact sheets to help your child, fact sheets how to talk to your doctor if you're a parent. There's developmental path posters to put in your offices and in your homes, just as a reminder and help to people that you have contact with. And then there's primers for physicians, WIC clinics, and early child care and educators. And those primers kind of just help those professionals have a one-page informational sheet as to how they can implement these materials into their everyday practices. I just want you to know that I'm really sharing just really a small portion of all the materials and information available through the CDC. So it's well worth your time if you can get on the website itself and go through a lot of the materials. All the materials are reproducible. The CDC shares them very freely. You can customize them. So if some of you have ability, you can make stickers and just put your contact information on the materials so that families can call you when they have a question or a concern. And again, a lot of them are available in Spanish and other language. And the materials are fairly popular, so sometimes they run out of them for a while, so you might have to wait if you place an order, but they ship them, and there's no cost to you. There are also e-resources available, and these are all downloadable materials. You can download them to like your own website or just for your own use, but there's like milestone quiz widgets, there's health e-cards, there's web buttons, videos, and I actually have downloaded the new Milestone Tracker app for my iPhone. That's not available yet to everyone, but the ambassadors are all trying it out. It's a really wonderful tool, I think. I think it's going to be very popular with parents because it tracks the milestones of your child. It has a scheduler for appointments so that they will be notified when a screening is due or when their well child check is due. It also has the tips and strategies and activities on the app, and it also has like a milestone quick view and a milestone summary in all the domains. So there are a lot of benefits of using Learn the Signs Act Early materials. It's pretty easy to integrate them into your daily settings across a variety of systems and settings. They really encourage parent engagement, which of course I think we would probably all agree is key to making this work. And it actually can change parent behavior. And the research shows that all the tools and materials can really help improve systems throughout our state. And so we really want parents and providers to know about these milestones and how to act early if there's any concern. Another wonderful tool that the CDC has is online training, and they have a wonderful autism case training curriculum for pediatricians and other healthcare providers. And so it's a three-module course, and there's the availability to get CMEs, MOCs, CEU credits, etc. And also really talks about culturally competent care, which I think a lot of people are very interested in. There's a lot of help on the site for early child care and education providers as well. There's also some professional development opportunities for them and for parents as well. And so all the materials are geared to provide them with some health and safety training. There's lots of toolkits that are downloadable. And again, the Milestone in Action photo and video library is free and available. The training for those folks is called Watch Me, Celebrating Milestones and Sharing Concerns. It only takes about an hour. They are able to get some continuing education. And again, it offers tools and best practices for monitoring development and talking with parents. And of course, the big piece of all of this is really to empower parents. We want parents to understand that watching for milestones is very important. Better understanding of what child development is all about. Pinpoint potential developmental concerns. We want to help and teach them, coach them, mentor them in how to help their child. Learn how to talk to their child's doctor and locate a variety of resources and supports. And of course, the big goal is helping parents get help for their child sooner. And we want them to always be willing and able and learn how to do it, talk to their primary care provider. We want them to contact early intervention services, like here in our state, we have early access to request an evaluation. If their child's over 3, they can contact their local elementary school. And if they have concerns about autism or any other developmental delay, they can always check that out with the Regional Autism Assistance Program. And of course, it's just so important to act now, act early, and act today. And so I can't encourage you enough to check out all of the tools and resources, and you can always call me, email me, and contact me about Learn the Signs Act Early, and I'll be happy to help with any technical assistance that I can, and direct you to the site where you can order any and all of these materials free of charge, and they'll send them to you, and you don't have to pay for shipping or anything like that. And I just want to remind you that it's all our jobs to help spread the reach of Learn the Signs Act Early. And I know your association shares a desire to collect and disseminate information about current research, training opportunities, best practices, funding, and policies to inform the system of children's mental health. And we know that if we all work together to help all children thrive, our state is really going to be able to show a difference in children's health care. So I'm going to open it up for questions, and I hope some of you have some.
Well, thank you very much, Rochelle. This is fantastic information, especially given the staggering statistic that 1 in 6 children has a developmental delay or disability. So I know I'm certainly overwhelmed with the amount of resources that are available for free. That's fantastic.
Right. And I just kind of also wanted to share that, there are other resources out there, and we value a lot of other resources and tools and things. So, these tools are also can be just used in addition to what some of the tools that maybe you're already using. So just kind of wanted to add that.
Yes, thank you. And I see your contact information is on the screen now. So if people are interested in contacting you directly, they have your email address right there and your physical address as well. So this is an opportunity for participants to ask questions. If you would like to ask a question, there should be a microphone icon in the lower left-hand side of your screen. You can unmute yourself and ask a question, or another option is there is a button that says chat. And if you type on that, or you click on that, you can type your question into the chat box. So we'll wait just a couple minutes to see if anybody has questions. Okay, so somebody has asked a question. The Watch Me training, is it a webinar as well?
Oh, the Watch Me training is, it's not really in webinar form. But it's online. You just go directly to the CDC website, and you can take the training, and then you register, and you can get a certificate, of course, that you participated in. There are some quizzes, and that way you can get the continuing education credit. Takes about an hour. It's 4 modules, and it has a lot of great training videos and pictures, and utilizes the actual Milestone library and that type of thing within the training. But I think you'll love it. And there's a great section of videos that help you learn about how to talk to parents, which I think is especially important. How to talk to parents, especially if there are some concerns, because it's such a sensitive subject to a lot of parents. So it's a great training, and it offers some visuals on modeling and coaching. So.
Okay, and it looks like we have another question. Is the autism training only open to healthcare professionals?
No, anybody can take it. So I've audited it, and I didn't find it overwhelmingly difficult. So I think it's really geared for a lot of different people. So I think both trainings have their merits, and I think the autism case training is very appropriate for parents as well as professionals.
Fantastic.
It takes a little longer than an hour. It's a little more geared towards, I think it covers about 7 different cases, and kind of takes you through those, but it's a really great training. So they're both free. You can you can register and get the CE credits. So, and or you can just take it and audit it like I audited the actual autism case training. So
Great.
meaning just observe it, and you can take the quizzes and tests, and but you wouldn't necessarily need the continuing education credits.
Okay. Any other questions?
And
Okay.
once Rhonda shares the PowerPoint, all the links to those trainings and things will be right on there. So.
And I'm not sure if I have access to everyone's email. The Zoom technology may not give me reports. I'm not sure if they do or not. But the information that Rochelle has presented today will definitely be on our website. The website is promotementalhealthiowa.org. That is our Infant and Early Childhood Mental Health Association website. And in addition to the video and the PowerPoints, I will also post a link to the resources that you provided, because I just think that's such a tremendous help for those who are serving Iowa's youngest children and their families. So I am not seeing any additional questions come through, so I guess we will go ahead and end the webinar. And I would like to thank everyone for participating today, but most of all, thank you to Rochelle for sharing this wonderful information. Definitely want to make sure that parents and providers have access to these fantastic resources. So,
Thank you.
All right.
Thank you, everybody.
Thank you all very much. Have a good day.